Thank you so much for having me, and thank you all for being here on a Saturday morning. I'm Naz Sadie from Philadelphia, and I'll share some interesting cases with you. All right. So this happened pretty recently. I actually asked Tom if I could include it with trade names because I don't want to confuse you guys on devices. But I got a very early text from one of my patients, and she's like, I had a very abnormal reaction. I've had many laser treatments before, but I've never experienced anything like this. So it turns out she had gone somewhere else, a local office, a very well-known plastic surgeon in our area, and 2 days prior, she had the BBL with the Moxie laser, and she started experiencing intense itching, burning. It was keeping her up at night. She was taking antihistamines just to help her fall asleep, and she was so paranoid and nervous because she was going to the Masters with her father in 5 days and couldn't go looking like this. So she shows up to our office before I even get there and demands to be seen and wants us to help her. So when I looked at her, it was kind of unusual. She had skip areas. Some areas were crusted. She had pustules on her forehead and on her chin, and it was very odd. The right side of her face looked like it was treated very aggressively, whereas the left side of her face looked like it was barely even treated with a laser. So I started her on doxycycline, I took cultures, we started her on clindamycin topically, and I told her to put a little bit of triamcinolone on the crusted areas. She was very paranoid about perioral dermatitis, but didn't want to use any kind of topical steroid. So we had her come in multiple days. She also was sending me photos and I would say updates, TID. So on day 4, she was having less, the edema had decreased, her pain had decreased, the pustules were pretty much gone, which was interesting that it resolved within 2 days, but she was having more crusting on her forehead and on her chin. And this is more of a response that I would have expected on day 2 with these 1927 devices. So day 6, she's continuing to improve, but some of these areas that were just treated with more intense energy were still crusted. So you can appreciate that on her lateral cheek, but also on her chin. This was the most recent photo that I got from her. She's going to apply some sunscreen. She's at the Masters, and she's happy as can be because she thought she was going to have some scarring and look horrible. So the issue here was that the 1927 was done first on one half of the face, followed by the BBL or IPL. She didn't have any ultrasound gel applied to her skin when the BBL was done. And then immediately after the treatment on her right side, she had noticed some burning and tingling and complained of pain. So when she had her left side treated, everything seemed to be dialed down. And immediately after her treatment, they applied their custom vitamin C. So by the time I saw her, I think she had a superficial burn. She definitely had areas that were skipped, including most of the left side of her face, and she had some irritation. The take-home message from all of this is there's so many of us doing procedures, and that's great, but you need to be able to understand the complications that can occur and manage them. Because when she called the provider who had done this treatment, she was told that she probably has a little irritation to the cream that she was given. Go to the drugstore, get some over-counter hydrocortisone cream, and she'll be fine. And that really wasn't the case. She needed a lot of hand-holding, and everything will be better. I think she'll end up having some persistent erythema, but no permanent scarring. So the takeaway was, if you're going somewhere, make sure they know how to handle the complications, and don't cheat on a trusted provider. And this also just brings up the concept of IPL, BBL. It's everywhere. It's completely commoditized. People are doing this in salons. And as a result, it gives people this false sense of security that it's so safe and you really can't cause harm. And the reality is that it can cause a lot of harm, and especially in patients who are darker skin, people who have active tans, so acute tans. And you just have to be really careful. This was a patient who came to me after she had had a CO2. She had a little bit of discoloration from her CO2, and then she was treated with an IPL. So she's pretty dark. I probably wouldn't treat her with a CO2 to begin with, and then I wouldn't follow that up with IPL treatments. And then this was a woman who had presented to our office. Her husband was a resident and decided to treat her stretch marks with an IPL. And she wasn't really even bothered by the stretch marks. So, I mean, there was a lot of psych stuff going on all around with this case. But what we did was we started her on topical bleaching creams, reassured her because she was very upset that she was going to look like this for the rest of her life. This was another patient who had presented to our office. She had some active acne and acne scars. Both were treated with IPL, and she noticed a lot of pain, especially when these active lesions were being treated with the IPL device. She ended up having some superficial burns. Again, the way that we approached her was with some topicals. And this is something that I wanted to discuss because a lot of fair-skinned patients also come in wanting IPL. They want their skin to be uniform and all one color. So I call this actinic bronzing. The problem is that if you treat them right away, you need to do with an IPL or a BBL device, you need to have a plan in effect. So where are you going to stop? If you're going to stop here where the t-shirt cuts off, that's not going to look great. So you really need to have a complete treatment. Treat the full arm, treat the full shoulders, and go over that plan with the patient. Also, I personally like to treat these first with a 1927, get rid of some of that actinic damage before you do any kind of pigment treatment. So how do I treat these patients who have issues with IPL? We do topical, strict sun protection, and then I'll do a low density 1927, and you just need to tell them to be patient. All of this will get better with time, and doing more necessarily isn't the answer. All right, a few more cases. So in the same week, my partner and I saw patients from a local practice, pretty much the same thing. So this was a week after a hybrid laser, and you can see the rest of the face healing totally appropriately. But what they did was they treated the whole face and then measured the perioral area and went over it again. So this was another woman treated by the same provider in the same week, same thing. The woman was really bothered by the perioral lines, and so she treated the whole face and then went over the mouth area again. And the problem is that you can't be super aggressive and increase the energy in just a certain part without knowing exactly what you're doing, and also feathering these treatments. So if you are going to do a more aggressive treatment, it needs to blend in with the rest of your treatments. And these high energy areas can increase your risk for scarring. So this is just an example at the bottom showing that as you are increasing the energy of this device, you can cause a scar. And these patients were managed with topical steroids, and then after a month treated with a vascular laser and also the 1927 to help with some discoloration. And Dr. Cohen touched on this, so I'm just going to wrap it up. Does everyone who gets non-ablative resurfacing need an antiviral? Yes. I kind of got a little lazy about this. Before, I used to put everyone on an antiviral. Then if patients said that they don't have a history, I would trust them and not put them on an antiviral. And this happens. We had a woman who had a soft wave done and 1927 that I had done immediately afterwards. She was a little swollen, no big deal. But she had this cluster on her neck that was extremely painful, and when we had asked her about HSV, she said she didn't have HSV. We had given her antivirals, she didn't take them, but she has this questionable history of shingles on her neck. We treated her with Valtrex for 7 days. She sent us a photo, everything all cleared, going to an event. So don't get lazy with antivirals. Even if your patients say they haven't had HSV, still treat them. If you do enough procedures, you're going to get complications like we've all talked about. We do our best to minimize getting complications, and if they occur, we need to know how to handle them. Thanks so much for your time.